Cardiac tamponade. Definition: cardiac tamponade is accumulation of fluid around the heart muscle, and as a result of this, there will be an excess pressure on this organ. You can see this diagram is a healthy heart, and due to the cardiac tamponade, it's fully the fluid accumulation is there. Coming to the causes of cardiac tamponade, and it results from the buildup of fluid between the layers of pericardium, and mainly acute cardiac tamponade fluid accumulation occurs very quickly, and it happens slowly in subacute cardiac tamponade. And the main causes for cardiac tamponade, that is severe chest injury and any post-heart attack or even hypothyroidism or an underactive thyroid. And even the inflammation of pericardium, that we will call it as pericarditis, and aortic dissection. Aortic dissection is nothing but when an injury to the innermost layer of the aorta allows blood to flow between the layers of the aortic wall. And any bacterial infection or tuberculosis and kidney failure, even cancer, lupus or any autoimmune condition. And in case of any bursting of an aortic aneurysm or bulging in the aorta. Fluid within the pericardium puts pressure on the heart. So this pressure will be preventing the heart from expanding completely and filling to capacity with the blood. As a result, so here the heart fails to complete expand, so there will be less amount of blood will be leaving the heart. As a result, there will be too little oxygen reaches the tissue. So as a result, the patient will be having tachycardia, rapid fall in blood pressure, and there will be faster breathing, feeling of panic and jugular vein distension. And finally leads to loss of consciousness and sudden death. Coming to the signs and symptoms of cardiac tamponade, there are three classic signs of cardiac tamponade. That is, commonly doctors say it's a Beck's. So whenever we are seeing a patient who has come to the clinic with any cardiac tamponade, it's any symptoms. So first we have to basically assess the patient with the Beck's. That is, first the patient will be having a low blood pressure in the arteries, and second there will be a muffled heart sound. Muffled heart sound, that is result when fluid or tissue act as a barrier between the heart and the stethoscope. And third, there will be a swollen or bulging neck veins, that is called distented veins. And even the people with the cardiac tamponade may will be experiencing more symptoms, that is a weak pulse, bluish skin, that is cool to touch, and lightheadedness and a rapid heart rate. And fainting, drowsiness, anxiety, sharp pain in the chest, back, abdomen or shoulder, and shortness of breath. Coming to the diagnostic evaluation. The diagnostic evaluation, so basically we will start from Beck's, and we will also check the person's blood pressure, listening the heart sound by auscultating, and examine the appearance of veins, that is the jugular vein distension. The next we will go for echocardiography, and echocardiography is a non-invasive procedure. Here it will provide a detailed image of the heart, which may help the doctor to detect fluid in the pericardial sac or a collapsed ventricle. And the next is chest X-ray. X-ray shows that the heart is abnormally large or an unusual shape due to fluid filled up. And the next electrocardiogram, this allows the doctor to examine the electrical activity of the heart. Then computer tomography scan of the chest can confirm the presence of extra fluid in the pericardium. Then finally, magnetic resonance angiogram is used as the magnetic field, the radio waves, so shows the abnormalities in how the blood flows through the blood vessels of the heart. Coming to the treatment. Cardiac tamponade is a medical emergency that requires hospitalization. And the treatment has two purposes. It should relieve pressure on the heart and then treat the underlying condition. And mainly initial treatment will be involved and make sure that the patient is stabilized. The draining of fluid from pericardial sac, typically with a needle and by giving local anesthesia. The name of the procedure we call it as pericardiocentesis. And here the doctor may perform a more invasive procedure that even after pericardiocentesis, that is thoracotomy. Thoracotomy, what is the purpose? Means to drain blood or remove blood clots if the patient have a penetrating wound. And in this occasion, they may remove a small part of the pericardium to help relieve pressure on the heart. And the other treatment, treat the patient with oxygen and fluid replacement to maintain hydration and to prevent hypotension, and the medications to increase the blood pressure. And once the tamponade is under control and the patient's condition, everything is stabilized, and the doctor may perform additional tests to determine the underlying cause of the condition. Coming to the nursing management, acute care management, we will assess the patient's status and hemodynamic monitoring, that is pulse, heart rate, blood pressure and respiratory rate, and neurological status, level of consciousness, orientation and confusion, restlessness and anxiety, and provide psychological support. And cardiovascular assessment, we will assess the heart rate, jugular vein distension and heart sound, skin color, etc. Nursing diagnosis: decreased cardiac output related to reduced ventricular filling, secondary to increased intrapericardial pressure. So here intervention, continuously we should monitor the ECG. The patient should be under continuous monitoring and monitor if there is any signs of dysarrhythmia, because it may result of myocardial ischemia secondary to epicardial coronary artery compression. And we should also monitor blood pressure for every 5 to 15 minutes during the acute phase. And the interventions: monitor the pulse paradoxes by arterial tracing, and arterial blood pressure monitoring should be done, and monitor urine output every hourly. Patient should be catheterized and should be connected to the urometer every hourly. We have to strictly maintain the output chart. A drop in urine output may indicate decreased renal perfusion, because every hour we have to assess and compare with the previous hours. And if you are assessing the patient's urine output as dropped suddenly, it indicates that the patient has a decreased renal perfusion. And as a result, there may be a decreased stroke volume secondary to cardiac compression. Assess cardiovascular status, monitor jugular vein distension and pressure of response sign, and skin temperature, color and capillary fill should be monitored. And we should assess the amplitude of femoral pulse during quiet breathing, assess level of consciousness for changes that may indicate decreased cerebral perfusion, and provide supplemental oxygen as ordered, and initiate 2 large bore intravenous lines. So make sure that the patient has a IV cannula both hand, so immediately for replacement of fluid. And pharmacological therapy, mainly we will be starting dobutamine. Why we are starting dobutamine? In order to maintain the renal perfusion, to low dose of dobutamine, that is 250 mg per vial. A single strength or double strength we can add in 5% dextrose, and we can start with 10 microdrops per minute. And monitor the patient for dysarrhythmia, coronary artery laceration, and the surgical intervention in order to identify and report bleeding site, to evacuate clot in the mediastinum, and to resect or open the pericardium. Thank you.